Loxoprofen is a nonsteroidal anti-inflammatory drug and SAID with analgesic pain-relieving, anti-inflammatory, and antipyretic fever-reducing properties. Its pharmacology involves the following key actions. Inhibition of cyclooxygenase COX. Loxoprofen works primarily by inhibiting the activity of the enzyme cyclooxygenase COX. There are two isoforms of COX, COX1 and COX2. By inhibiting COX1 and COX2, loxoprofen reduces the production of prostaglandins, which are chemical messengers involved in inflammation, pain, and fever. Anti-inflammatory effects. By reducing prostaglandin production, loxoprofen helps to decrease inflammation in tissues. This is particularly beneficial in conditions such as arthritis and other inflammatory disorders. Analgesic effects. Loxoprofen's inhibition of prostaglandins also contributes to its analgesic pain-relieving effects. It can help alleviate pain of various origins, including musculoskeletal pain, headaches, and dental pain. Antipyretic effects. Loxoprofen can lower fever by reducing prostaglandin production in the hypothalamus, the part of the brain that regulates body temperature. Platelet aggregation. Loxoprofen may have some effect on platelet aggregation, which can affect blood clotting. This effect is generally less pronounced compared to other NSAIDs like aspirin. Loxoprofen tablets or capsules typical adult dosage for pain and inflammation. The usual starting dose is 60 milligrams to 120 milligrams taken 2 to 3 times a day. The maximum recommended daily dosage is typically around 180 milligrams to 240 milligrams. Loxoprofen dispersible tablets. These tablets are designed to be dissolved in water before consumption. The dosage can vary, but it's typically 60 milligrams to 120 milligrams taken 2 to 3 times a day. The most common side effects associated with loxoprofen, like other nonsteroidal anti-inflammatory drugs and SAIDs, can include gastrointestinal symptoms. These are among the most common side effects of NSAIDs and may include stomach discomfort, indigestion, heartburn, nausea, vomiting, and in some cases, gastrointestinal ulcers or bleeding. Headache. Some individuals may experience headaches as a side effect of loxoprofen. Dizziness. Loxoprofen can occasionally cause dizziness or lightheadedness. Skin reactions. Skin rash or itching may occur as a side effect in some individuals. Elevated blood pressure. In rare cases, loxoprofen can cause an increase in blood pressure. Fluid retention. Swelling, particularly in the hands or feet, may occur as a result of fluid retention. Gastrointestinal ulcers or bleeding. While less common, the use of loxoprofen, like other NSAIDs, can lead to more serious gastrointestinal side effects such as ulcers or bleeding. This risk is higher in individuals with a history of gastrointestinal problems. Allergic reactions. Allergic reactions to loxoprofen are rare but can include symptoms like skin rash, itching, swelling, severe dizziness, and difficulty breathing. Seek immediate medical attention if you experience these symptoms. Loxoprofen, like other nonsteroidal anti-inflammatory drugs and SAIDs, can interact with various medications and substances. Some of the most common interactions include other NSAIDs. Concurrent use of multiple NSAIDs, including loxoprofen, can increase the risk of gastrointestinal side effects and bleeding. Anticoagulants, blood thinners. Loxoprofen can enhance the anticoagulant effects of medications like warfarin or heparin, potentially increasing the risk of bleeding. Close monitoring and adjustment of the anticoagulant dosage may be necessary. Antiplatelet drugs. Combining loxoprofen with antiplatelet drugs like aspirin or clopidogrel can also increase the risk of bleeding. Corticosteroids. Using loxoprofen with corticosteroids can elevate the risk of gastrointestinal ulcers and bleeding. Selective serotonin reuptake inhibitors (SSRIs). There's a potential for increased bleeding risk when loxoprofen is used in combination with SSRIs, like fluoxetine or sertraline. Certain blood pressure medications. Loxoprofen may reduce the effectiveness of antihypertensive medications, potentially leading to increased blood pressure. Diuretics. The use of diuretics in combination with loxoprofen can affect kidney function and electrolyte balance. Lithium. Loxoprofen may increase lithium levels in the blood, potentially leading to lithium toxicity. Methotrexate. Concurrent use with loxoprofen can increase the risk of methotrexate toxicity. Certain antibiotics. Some antibiotics, such as ciprofloxacin and sulfonamides, can interact with loxoprofen and increase the risk of central nervous system effects. Alcohol. Combining alcohol with loxoprofen can increase the risk of gastrointestinal bleeding.